So we're going to discuss today a baby surviving umbilical cord prolapse and then suffering an HIE injury, hypoxic ischemic encephalopathy, a type of traumatic brain injury. The purpose of this talk today is because I shot a video a few days ago in which I was talking about umbilical cord compression, and I was talking about the importance of understanding mom's contraction pattern during labor and delivery. And in those videos, I got questions offline, and one of those questions had to deal with this condition called umbilical cord prolapse. Now, umbilical cord prolapse, thankfully, is something that is rare. It's a rare condition, but it can still happen. So I'm going to define for you today what is umbilical cord prolapse in its most basic sense and why this is a very serious condition and why it can create an emergency. So umbilical cord prolapse is essentially when the umbilical cord is delivered before the baby. The umbilical cord can move out of the uterus into the vagina, and this can cause serious problems. One of the main areas of concern when umbilical cord prolapse occurs is umbilical cord compression. And like I said, check my other videos in which I go into way more detail as to umbilical cord compression and why this is problematic for a baby. But getting back to umbilical cord prolapse. Umbilical cord prolapse, not only does your baby run the risk of suffering a traumatic brain injury like HIE, but in some cases, death can even result when we're talking about umbilical cord prolapse. Now, on the board, I have talked about, or I've laid out for you some of the risk factors, what can increase the risk of an umbilical cord prolapse happening, and from a medical legal standpoint, why these things are critical when we are analyzing these cases and trying to help families understand how did their baby suffer this traumatic brain injury, this HIE brain injury. Was this medical malpractice that caused this, or was it genetics? Was it developmental? What caused it? And so these risk factors, with the first one being is when water breaks. When mom's water breaks, sometimes what can happen is that as the fluid is moving out of the uterus and flushing out, the umbilical cord can also get washed down with the water when it breaks. So that's the first risk factor. The second one is going to be the baby's position. What is the baby position when we are dealing with labor and delivery? We want the baby to be moving into a head down position. If the baby's head is not down, if the baby is in any other position, then that increases the risk for an umbilical cord prolapse to occur. And I've combined the last two together. When you have a low birth weight baby, a low birth weight, preemies, low birth weight, or twins, these things can also increase the risk factors for an umbilical cord prolapse. Now, there are things that are present that can alert doctors and medical professionals as to this umbilical cord prolapse. And the main one being is that you will see a drop. You generally will see a drop in the baby's heart rate. And this can be because of umbilical cord compression. Now, if you've watched those other videos that I talked with you about, when I go into detail as to umbilical cord compression, what you will see is that when mom has her contraction, you're going to see things called late decelerations. Usually when things are going well, when mom has her contraction, the baby heart rate is going to dip down. It's going to meet up with that contraction and it's going to go back. When you have compression, umbilical cord compression, you could have what we call late decelerations. The contraction pattern happens, but the baby does not react to the contraction pattern when it happens. The baby reacts after the contraction. So these late decelerations and the baby's heart rate dropping, these are serious signs, and they cannot go on for a long time because that can put the baby in danger. And the second one being sometimes doctors, they will be able to, when they're doing physical examinations, they may feel the umbilical cord in the vagina when they're doing a physical exam. So these are signs and symptoms that may alert medical professionals that an umbilical cord prolapse that might be there. Now, managing this, how do doctors and nurses, management, what is the answer for this? When there is umbilical cord prolapse, delivery has to happen. Like, it has to happen because of, like I said earlier, the threat of umbilical cord compression, which is going to cut off or reduce the level of oxygenated blood getting to the baby, which can cause problems. Now, when we're talking about HIE or hypoxic ischemic encephalopathy, that type of traumatic brain injury, what is HIE? HIE is a reduction of oxygenated blood getting to a baby, which can cause or lead to a traumatic brain injury. It's an oxygen deprivation which can lead to a brain injury. And that is why umbilical cord prolapse is so dangerous, because of the threat of umbilical cord compression, which can then move you into that area of a possible HIE brain injury. Now, for management, like I said, fast delivery. We need immediate delivery. An emergency C-section, that is probably going to happen, or they're going to move to get the baby out, because if not, if this compression goes on, the longer that it goes on, the more risk to the baby of not only a traumatic brain injury, but in some instances, death. So I say all of this today to help you understand, yes, umbilical cord prolapse, it is a rare condition. Yes, it is rare, but it can happen. And when families contact us and they're trying to figure out, they had a umbilical cord prolapse was going on, now the baby has a traumatic brain injury, one of the main areas we're going to look at is we want to know, when was this thing diagnosed? When did the doctors know that this was there? Did they notice it? And then if they did, what did they do accordingly based on what they saw with everything? Because like I said, if you wait too long and this compression goes on, the baby has it has a restriction or a cutoff of oxygenated blood, you can there can be problems down the road for the baby. If you have more questions, maybe you're watching this video today because your baby has suffered a traumatic brain injury like HIE, and you have questions as to what caused this injury. If that is you, what I invite you to do is to get your cell and give me a call. There's a telephone number on the screen. Go ahead and get your phone and give us a call. Remember, when you contact my office and you talk with my secretary, make sure that you pick a good date and a time to get on our calendar, a date and a time that you're going to remember and that you're going to be able to talk. Make sure you let our secretary, let them know that. In addition to that, you want to make sure that you leave them a good working email address, an email address that you check frequently, because sometimes we will have to communicate with you by email, and we want to make sure that we're sending it to an email address that you check frequently. And finally, I practice law here in the state of Maryland, and I know sometimes we'll have individuals who will contact my office. They are in the United States, but they're not in Maryland. If that is you, just please understand that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something that we can look to work to help you with. But I just want to make sure that you understand that co-counsel, that local counsel aspect, if you are not here in the state of Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group LLC. Talk with you next time. Take care. Enjoy the rest of your day.